the SSTC Curriculum Review Committee and the coordinator for simulation of the College of Medicine and Dentistry. She's a basic life support and an advanced cardiac life support instructor at the American Heart Association. She's passionate about lifelong learning and teaching and is in the field of education since 2005. Starting young as a faculty in St. Louis University School of Nursing, Baguio City, Philippines, her humble beginning made her believe that education must be nurturing, not torturing. She was given the Innovative Ideal Award in the first SIMGOS conference by the year of 2020, held at Princess Nourah BintAbdulrahman University in Riyadh, KSA. So let's all welcome her, and she will be presenting a tool towards developing a professional identity in nursing.
Thank you. Thank you so much, Ms. Nadine, for that warm welcome. Can you hear me?
Yes, we can hear you.
Perfect. So I'll just share my screen. Just give me a moment. All right. So I will talk about the tool towards building a professional identity in nursing. So I have 30 slides. So I will just take 30 minutes of your time or lesser. So just wear your seatbelts and let's get the ball rolling. So what is professional identity? Professional identity actually is a foundational reference in the nurse's cognitive process to which decisions are being made. What do I mean by this? So professional identity is actually one's belief about what it means to be or how will I act as a nurse. So in other words, these are values and beliefs that are held by nurses as their guiding principles. So these are how they think as a nurse, they behave as a nurse, they act as a nurse, or they communicate and interact with the interdisciplinary profession as a nurse. So building and maintaining a positive professional identity actually support patient care with a positive environment that would enhance job satisfaction and retention rates. I was always reminded by a clinical instructor when she said that when you lose enthusiasm in your work, always remember what was the drive that you chose nursing as a profession in the first place. So professional identity also aids a professional nurse or a student nurse in making a sound decision in caring for their patients with respect of their personal values and also the values of others. So how does reflection build professional identity? So first is that in reflection, student nurses or nurse professionals are able to develop awareness to themselves and their professional awareness. Also, reflection would assist nurses to become thoughtful individuals. Also, reflection encourage and teach both students and professionals to be capable of critical thinking and to analyze or to have an analogy to come up with innovative ideas. So reflection is a tool for the analysis for the nursing practice, nurturing both the understanding of professional nursing and the building of important, thoughtful approaches essential for providing nursing care in a multifaceted and dynamic working conditions. Now, what are the events that bring reflection to a professional nurse or to a student nurse? So these are the antecedents which we call for reflection. First is there is a gap, or there in the clinical setting, there would be a gap between their thought and action. So what does this gap means? First is the ideal options are readily available. So they have options that they know, that they have learned from the university. But then these ideal options are unclear. So what happens to a student nurse, for example, or a professional? So they would have the analysis of the experience that um, and what they thought they know. So what would happen is that they will have an uncomfortable feeling of what is happening now. Why is there this gap between what I'm thinking and what I did in for the patient, for example, or in the patient care, or in the actual setting? So what would happen is that they would realize that the knowledge applied to the patient care was not enough to explain what had transpired in their action. So what would reflection help these nurses? So the nurses, through reflection, are able to improve their critical thinking and problem solving abilities, because they're able to think that there is a gap between what they learned and what they had acted upon. Also, they're able to identify their strengths and their weaknesses. Also, they will be able to identify the need for their growth and their learning. And also, they would adopt, or they would have to devise alternative safe ways in solving clinical dilemma in the future. Next would be the gap between theory and practice. So, as nurses transcend from the schools to the clinical area, they soon be faced with a break between what was learned in the university and what they see in reality. So, progressively, we can see that reflection can contribute to bridging the gap between what they have learned in the university and what have they seen, or what they are experiencing in reality. The third is the advancement in knowledge and technology. So the expansion and shifting of role in advanced practice creates a demand for nurses to act more autonomously and make fitting clinical judgments. So they need to apply special knowledge or specialized knowledge in dealing with both the well and the sick, in collaboration with the interdisciplinary or the multidisciplinary team. So now, um, this change brings about the need for reflection in practice and also in the nursing education. The fourth one is values and cultural differences also brings reflection in practice. So problems may be seen to have rooted from differences in practice and multiplicity of beliefs as influenced by upbringing, depending on one's country or place of origin. So this possesses a challenge for nurses to develop transcultural competencies and sensitivity. So, reflective learning is an important strategy to promote critical thinking and self inquiry regarding their own cultural values and how to adapt demands of the patient and their family without compromising their own values and beliefs. And next would be the advancement in education and learning. So, the development of more complex assessments and evaluation in nursing education. So it is now leaning towards the interaction of the inner self of a student nurse or with a professional nurse with others to attain sense of accomplishment and self-actualization. So reflection can be a tool or is a tool or as a tool can enhance self-effectiveness and respect of self and others. Now, what then is reflection? So what are the attributes of reflection? So reflection is a deliberate process of experience analysis. So here, the professional nurse or the student nurse will be free in processing of their experiences and how are they going to analyze this experience and how this experience has impact to themselves and to their practice. So this is a tool to provide opportunity for learners to freely reflect from their experiences. So reflection also helps the learner to deeply understand what has transpired in their experiences so that one can improve their decision making, their behavior, and their approach of their practice. So it leads to a plan of changing and having new actions, taking necessary steps to change their thinking. I also remember in nursing education, they said that in learning will only we can prove that there is learning when there is a change in attitude or there is a change in how they do things. So let me walk you through the process of how reflection is done. So there is an experience in one's practice that has in fact impact on their feelings or in their emotions. So what a professional nurse or what a nurse will do here is that they will reveal the story and they will reveal the story, and after which they will have an internal examination of themselves, of their values, of the impact of this, and there would be deep analysis or deep reflection of what had transpired. Now, after that, they would evaluate themselves and other factors. For example, um, the lack of technology, for example, or the lack of their knowledge. And that would aid them or that would lead them to have an action plan. Also, reflection is a spiritual and emotional quest and examination of their inner self. So, internally assessing and reflecting on past decisions, one can use reflection as a method of identifying uncomfortable feelings that made them think over the situation. So this the reflection would make one critically appraise and analyze the situation in different perspectives. Thus, they would develop new insight from the experience. So this is rather a instructor would rather tell them, please, before you have your duty, read your books. But now here, they would have to have a sense of reflection, and they would have to have their own meaning of, oh, so it means that I have this gap in my decision making, then the next time I will have my duty or the next time I will be taking care of the patients, I would prepare and I would read books, I would read journals, so that when I come to take care of patients, then I would be rather be prepared. So also, reflection is a thought process relying mostly on memory. That's why when we have, for example, the briefing sessions, we usually do this immediately after an experience of the student nurse. So at the end of relieving and describing a situation, nurses from their memories internally examine their thoughts and emotions about the situation. So they will draw learning from experiences that are poorly defined, complex, and are influenced with many factors. So this is very important to it is important that they are able to deeply assess and analyze what had happened and what are the influences in the issue of concern. So now, what are the consequences or the results of reflection? Sorry. First is there would be increased critical thinking skills in a professional nurse's life or in a student nurse's life. So reflection brings a nurse to critically analyze situation, being aware of their own belief, their own values, their own strength, and their own weaknesses, deciding on what to accept as their own guiding principles. And nurses are able to formulate questions, hypotheses, alternatives, and plans to test their own principles by either experimentation or making mental maps. So this in turn increases self-awareness, acceptance of their role as nurses and their responsibilities, and that they are a member of a larger institution. Also, reflection facilitates communication and collaboration. So, reflection brings professional nurses to realize their own knowledge, their theoretical underpinnings in nursing by either accepting, challenging, or upgrading knowledge to meet the need of the present situation. So nurses are able to contribute to the multidisciplinary team about their enhanced knowledge and to add something to improve practice, thus improving patient care outcomes as a whole. Also, reflection brings about professional development. So, as nurses are able to identify gaps in their knowledge, and thus this would open the need to improve themselves. Because, as we say, learning doesn't end when we graduate. Learning is a lifelong process. So, they are able to identify opportunities of growth as a person and as a nurse. Awareness of one's roles and responsibilities also as a member of a profession. So they're also be able to recognize support for finding solutions in deciding during uncertainty. And also reflection brings analysis of the reasons of embracing the nursing profession as one's calling. So to wrap up our discussion, first is reflection is a continuous deliberate process enabling nurses to develop professional identity. Through the cycle of reflection, nurses become aware of themselves and their caring skills. And nurses then are able to better communicate with their patients, their colleagues, and other members of the healthcare team. And as a lifelong learner through reflection, a nurse is able to acquire self-directed learning skills leading to obtaining their professional maturity. So these are my references. Thank you so much for listening with the short talk. Do you have questions?
Thank you, Doctor, for this wonderful presentation. It's really important that we have a good reflection which can improve our professional identity. So do we have any questions from the audience? Okay, Doctor, then I have a question for you. So because the presentation was actually interesting. One of my questions is, one of the concerns of the nurses are the long shift hours and the work overload that they have. So how would a nurse practice that reflection? So can it be done by coaching in the hospital or even privately? Because that would take time. Although participating in multidisciplinaries and group talks would enable a group reflection, but it's always your inner reflection that would help you develop and analyze better, I think.
Yes, that's right. So it's also a responsibility of us educators to teach professional nurses on how they are going to do about their own reflection in their personal lives. Because as we say that learning is really doesn't end there, and learning is really continuous. And it is really also very important that we encourage, like what we have been talking about empowering nurses to have their voices. So it is also good to, for example, in our hospital, we have like journaling, so where nurses can share their voices out, and we can like read their own reflections, and it is really beautiful when we read their point of view, what they have learned, and it is really a good sharing avenue for professional nurses to be giving their experiences in the clinical setting.
Thank you, Dr. Charmaine. That's really wonderful and supportive. So do we have any more questions from the audience? So thank you again. I think now we can move into our lunch break.
Yeah.
Thank you.
Okay.